Have you ever heard of Lymphogranuloma Venereum, also known as LGV? It's a type of sexually transmitted infection, or STI, caused by the Chlamydia trachomatis bacteria. This particular infection can cause proctitis, an inflammation of the rectal lining, and is commonly found in individuals with human immunodeficiency virus, or HIV. If not treated, LGV can lead to long-term damage to the genital area. However, with the correct treatment, typically antibiotics, the infection can be controlled. Now you might be wondering, what are the symptoms of LGV? Well, sometimes LGV might not cause any symptoms at all. But when it does, they usually appear in 3 stages. In the first stage, a small, painless bump develops, which can be filled with pus or not. This bump often appears on the cervix, urethra, vagina, or rectum, and it usually goes away on its own after about a week. As the disease progresses, it could lead to proctitis, with symptoms similar to inflammatory bowel disease. The second stage of LGV might affect your whole body, with fever, swollen genitalia, and swollen lymph nodes as some of the symptoms. And in the third stage, severe health complications can occur, such as brain inflammation, severe swelling of the genitalia, and scarring of the genitals or rectum. So what causes LGV? The infection can be contracted through vaginal, anal, or oral sex with an infected person, and unprotected sex carries a higher transmission risk. LGV is caused by specific strains of the C. trachomatis bacteria, which are different from the strains that cause genital chlamydia. Anyone who is sexually active can get LGV, but there are certain risk factors that can increase the likelihood of contracting the infection. These include having multiple sexual partners, having unprotected sex, and having a history of other STIs. In conclusion, lymphogranuloma venereum is a sexually transmitted infection that can cause severe complications if left untreated. However, with the right treatment, which is usually antibiotics, the infection can be managed. Remember, practicing safe sex and regular STI testing can greatly reduce the risk of contracting LGV.